Hey everyone, Dr. Richard Lai here with Study Acupuncture with me. So today's episode is sort of impromptu. It's coming from my car, obviously, and I was going back and forth whether or not I should go out and record this or not because it's basically a ticking time bomb that I have right now. I have very limited amount of time. My wife is at work. She's at a gig in New York City. I have my daughter and I have my almost 2-year-old son. He's napping right now, and I'm giving my daughter some screen time so that I can come out here and record an episode with you. I fought myself in my head about this over and over because I thought, well, I have to get my microphone, I have to get my camera out, I don't want to use my phone, I don't have good lighting, I don't have a good background, all this stuff. And I realized it's not about any of that. It really is just about having the time to do it and having the willingness to do it. You can try to be a perfectionist about everything. As long as you have time is your most important tool. So as long as you have the time to do something, do it, because time is the only resource that you cannot get back. And no amount of money that you have in the world can buy back even a second of time. So time is the most important thing. So take advantage of your time. I'm saying that to myself as well as reminding you. So again, my name is Dr. Richard Lai. Welcome back to Study Acupuncture with me. So this episode, I want to talk about evaluation techniques. So for our patients, as an acupuncturist, evaluation is actually a very important part of the patient's journey. It is the first part of the patient's journey, actually. And everything that we do for the patient depends on the correct diagnosis. So if you can diagnose properly, that means you can identify the right pattern. That means you can choose the right treatment principle. And when you have all of that right, your patient gets better in an efficient manner of time. And that's truly helping your patient. So that's what makes evaluation such an important part of your patient's journey. So this episode is inspired by a comment that I saw that was left on YouTube. And it said basically, can you talk about how to choose the right diagnosis for the patient? And about, the thought process that we as acupuncturists employ. And so I thought that was a really great question. And it is a great question to think about in terms of board prep, but also it's a good question for real world practice. So today, let's break down the entire evaluation process from soup to nuts. So in our evaluation, the first thing that we start with is something called observation. So observation in Chinese medicine, this is one of the first of 4 examinations or the 4 pillars. We are going to be observing or looking at the patient's face, their tongue. We're going to look at their body posture. We're also going to look at their spirit or their shen. In Western medicine, this really lines up with the first pillar of diagnosis or evaluation, which is called inspection. It's really the same idea. It's basically, what do your eyes see? So for example, in Chinese medicine, I will look at their tongue and I will notice a red tongue tip. I'll notice that there's very little coating. Or I'll notice that the patient's walking in, they're very slouched, they're very heavy, they're very slow. In Western medicine, we might check their skin for rashes. We might check their extremities for swelling. Maybe one leg is swollen, the other one's not. Sometimes it's as simple as looking at them as they stand up from the chair. Do they make a face? Do they move stiffly? Do they protect one side versus the other side? All of that is information. And honestly, for this, the only tools that you need are your eyes. And they have to be well-trained eyes. Sometimes you might use a tongue depressor. Sometimes you might use a pen light that can help you see more clearly or help you get to the back of the tongue a little more easily as well. The real skill just really lies in your ability to pick up all these subtle things in your patient's characteristics that can help lead you towards identifying a pattern. Now, from inspection, we move on to the next pillar, which is called touch. So in TCM, we touch or we palpate. So we feel the pulse, we palpate the channels, we'll press on tender points. And depending on what we find, we might find tender points along a certain channel. We might find some sunken places. We might find some cold places, some hot places. All that tells you a lot about the patient's presentation. In Western medicine, palpation is pretty much the same thing, but instead of going along the channels, we might use our hands to assess dermatomes, or we might assess tenderness near joint lines or muscles, or we might palpate their abdomen and see what is happening in certain quadrants. So we're assessing for pain, rebound pain. We're also assessing for warmth. We're assessing for swelling, like at the elbow, at the ankle. We're basically looking to see if there's any pathological changes from one side to the other or in specific areas. When we're palpating their abdomen, we might be palpating for organ size. if there's a larger liver or larger spleen than normal. We could call that splenomegaly or hepatomegaly. And this just means that we might have to refer them to further practitioners. So there could be like cirrhosis or hepatitis or something, and we are not able to assess that just with palpation alone. Regardless, whether it's Chinese medicine or it is Western medicine, we are using our hands to feel the body and see what the body is telling us. When we palpate the pulse, do we feel the wiry pulse? When we palpate the trapezius, do we feel any knots? Do we find any tenderness in any certain abdominal quadrants? Do we feel if the joint is warm or inflamed? Your hand is your primary tool, and your hand is your evaluation tool. You might sometimes use a goniometer. You might sometimes use a reflex hammer, but mostly you're using your hands. All right, now next comes sound. So in TCM, we call this listening and smelling. So we're paying really close attention to our patient's voice, their breathing. We might even take in some body odors. 5-element practitioners do take in their body odors. Like, for example, certain smells that come from the patient, we could relate it to a certain element. And that could be related to a certain organ. Like, for example, if the patient has a scorched smell, that odor corresponds with the fire element, and the organ of the fire element is the heart. So you can start to assess for some heart-related manifestations to see if it is the heart that's the root cause of whatever they're presenting with. Or you might start to ask your patient if they have certain characteristics related to the heart, like anxiety, trouble sleeping, poor memory, things like that. In Western medicine, the third pillar is percussion, which is similar to listening. So it's tapping the abdomen, tapping the chest. We're trying to hear for the quality of that sound. So we can tap our finger directly over their abdomen, or we can cover the area with our hand and tap the back of our hand. We see if there's like a hollow sound or a dense sound. If there's a dense or a dull sound, that means there's something there. It's solid. Or if it's a very tympanic sound, maybe there's a lot of gas in that area. It all depends on what area you're tapping. It might be normal, it might be abnormal. It all depends on the area. So if I percuss certain areas of the chest and I hear a dullness instead of like that tympanic resonance, that might tell me that there's some fluid in that area, which could be something, could be pneumonia, whatever. I would refer to primary care in order to fully diagnose that. If we tap the abdomen, if they're bloated, there might be gas there might be fluid there. So that's what we do in Western medicine. In Chinese medicine, we aren't really percussing, but we're really listening to our patient. It's part of the listening and smelling pillar. So we're listening to the quality of their voice. Do they have a weak voice? Do they have a soft voice? We're thinking maybe some qi deficiency, maybe some lung qi deficiency. Do they have a strong, loud, rapid voice? Maybe it's an excess condition then. Maybe there's heat involved. So that's the listening and smelling pillar. The last pillar that we have is called the asking pillar. So this is where we ask our 10 questions, which we all know it's not actually 10 questions, but basically we're talking and asking our patient through a very thorough history taking. So we ask them questions about their sleep. We ask them questions about their digestion. We ask them questions about their emotional state, about their lifestyle, their habits. We ask them a lot of questions. And in Western medicine, we also ask questions mostly catered towards like past medical history, past surgical history, prior living environment, even social history, like who do they have at home that's helping them, etc. Actually, in Western medicine, we do something about listening, which is auscultation. So auscultation is where we're listening to our patient with a stethoscope. So we can listen to their heart, we can listen to their lungs, we can listen to their abdomen for abdominal sounds too. So that's sort of a listening pillar in Western medicine. So again, that tool that we would be using is a stethoscope. So we're listening for sounds in their lungs, heart sounds, even sounds in their abdominal area. Now, in terms of sequencing of all of that, so it's not like it has to be wrote like from one pillar to the next. It's not like you have to stick to that. You can go from wherever you want as long as it follows some sort of clinical flow. We just go with the flow that the patient's presenting to us with. So for example, we might bounce around between listening and asking and palpating. So for example, we might start with the looking pillar. As soon as we see our patient in the waiting room, we see how they stand up. So we're looking, we're observing how they walk, how they're guarding, how they shake your hand, if they have any apprehension when they're taking off their jacket, or if they're wincing when they start to sit down. So we get a general idea of the available range of motion that's in their shoulder and in their back and in their arms and legs. Now, once they're settled in your treatment room, Then you start to dig in. You start to ask questions like, what seems to be bothering you today? And they might say their shoulder. So you notice that they had some wincing when they took off their jacket. So you start palpating their shoulder. You start palpating the meridians all up and down their arm and on their back. Then you go to the asking pillar. You start asking, when did they start feeling these symptoms? What kind of pain do they have? Is it sharp and stabbing? Is it dull? Is it numbing? What kind of pain are they experiencing? And while you're doing this, you're palpating for any tender spots. You're also assessing for available range of motion that they have. So hopefully, although I'm talking very quickly, hopefully you see it's not something regimented, like from one thing to another. You don't have to complete one pillar and then move on to the next one. You can go and flow back and forth between the pillars until you gather all the information that you need. And then once you actually gather all that information, you start to organize it in your brain. And in TCM, what I do is I slow down, I start to sort it through the 8 principles: yin, yang, hot, cold, excess, deficiency, interior, exterior. It basically gives me a compass for what the patient's presenting with. In Western medicine, my compass is it a musculoskeletal condition? Is it a neurological condition? Is it a systemic condition? Is there red flags? Are there yellow flags? What systems does it actually involve? And what system best explains the majority of the findings? So that's where my physical therapy background comes in. If they have limited range of motion, they have pain, I will tease out if is it a musculoskeletal issue, is it a neurological issue? I'll compare their active range of motion with passive range of motion. If their passive range of motion is full, but active is limited, I know I'm dealing with a muscular issue, maybe even a nerve issue. If both is limited, so I start to think about inert structures. Is it a joint issue? Is it a ligament issue? I'll also test myotomes and dermatomes. I'll see if there's weakness in a myotome, which could mean that there's a nerve root issue. If there's an issue with their sensation along a dermatome that I'm finding, that means there could be a spinal nerve root issue. All this helps me to know if I'm dealing with an inert structure, a muscular structure, or a nerve pathway issue. Now, once I've started to narrow things down, I take a step back. I look for the root and the branch. So for example, if I see that it's something to do with the spleen, the root is spleen qi deficiency. The branches, their fatigue, their loose stools, their weakness, all that stuff. In Western medicine, maybe I'm looking to see that the root is from the spinal nerve roots and the branch or the manifestation is the numbness in their fingertips. So basically, I'm assessing to see what am I going to start with. I assess the severity of the symptoms that the patient is present with, and I have to analyze whether I should address the manifestations first and then the root, or if I can just start from the root and know that the manifestations should get better as a result. That all depends on your patient's presentation. Now, lastly, what I do is internally, I will ask myself before I start to talk with the patient, I will make sure that I can explain the diagnosis, all of its manifestations as well, in the simplest of manners. I don't want to seem like an egotistical person and seem like I am better than the patient because I know all of this stuff. I want to be able to explain to the patient in words that they understand that can really resonate with them. So that way I know I'm right on the money with them. And that way I can actually get the most buy-in and gain the most trust from them, because healthcare is a partnership between us as healthcare providers and the patient. It can't just be me doing everything and the patient not doing anything, because they live their own life 23 hours a day and they come to us for an hour. So they need to be able to take what they learn from us and execute on it so that they can better themselves or at least help their condition improve. So it's really important for us as healthcare providers to bring all the information that's available to the patient, and that way we can help them make an informed decision about their own healthcare. Because again, our treatment alone isn't really enough to help the patient. We have to partner with the patient on their care. That way there's carryover at home. All right, so to summarize everything, in Chinese medicine, we have those 4 pillars. We have looking, we have asking, we have listening and smelling, and we have palpation. In Western medicine, we have inspection, we have palpation, we have percussion, we have auscultation. When we evaluate our patients, we bring all these pillars together. We carefully observe them, we assess them, and we reassess them. We assess all the different systems in their body, and we try to get to a simple, clear diagnosis, because a good diagnosis means a good treatment plan. And the better we are at listening to the patient's body, the better we are at recognizing the patterns and simplifying them for the patient, the better healthcare we're able to provide to them. All right. That was it. That was everything that's been on my mind. Thank you for listening. And also thank you again for the YouTube commenter for asking this awesome question and getting my brain rolling. So if you have any topics, you have any ideas, make sure you comment below. I am reading them. They're mulling over in my head. And then I just dispense it out through a video. And also, if you want some practice with board exam questions, sign up for my Quick Win newsletter. It's a very easy 5-minute read once a week. StudyAcuWithMe.com/quick win. All right, everyone. Until next time, God bless and happy studying.